Did we make it?
We made it. Hi, Katie. It's good to see you.
Hi, Samantha. Good to see you as well.
So we're here today to do a little bit of basic Q&A on what therapy is for folks who might be new to this process, because we recognize that there's a lot about this that can feel a bit daunting to get
Hmm.
into. There's some different terminology that you might be seeing when you're looking up therapists on Psychology Today or other search sites. And so our aim today is to help make this feel as accessible as possible for folks.
Yes.
So, Katie, if you are open to doing a brief introduction about who you are in the Room to Breathe
Yeah.
world and the type of work that you typically do, then we could jump into some questions I have for you.
Yes, absolutely. So, like Samantha said, my name is Katie. I am a therapist here at Room to Breathe. I have been here for many, many years, almost 10, which feels
Um,
like I'm aging myself, but that is very true. I am a marriage and family therapist. So the letters after my name are LMFT. We will get into that in a little bit, but yeah, so I work with a lot of individuals, a lot of couples, um, and I supervise other clinicians too. So I have been in the world of private practice for quite some time. So hopefully I can clear up misconceptions and answer questions. And as you said, Samantha, make it a little bit easier for those who are new to the therapy world.
Fantastic. Yeah. Yeah, so I'll jump in with some questions that I have, and then, if folks who are listening to this or listen to snippets of this have any additional questions, we'll be sure to connect at the end with your email and my email as well, so folks could
Yes.
reach out to us, so we could always do a follow-up.
Yes.
The first question that I had for you is, where do therapists work? How do you find a therapist out in the world? And where do you go to look for someone if you're wanting to work with a therapist?
Yes. So there's a few different avenues that you can take. Obviously, Google searches are part of that process as well. But I think for a lot of folks that we see, that you can and people want to go this route, like go the insurance route. So they may look and may go to their insurance, um ask for a referral that way, kind of look up online. There's also, though, different websites like Psychology Today that can be helpful in finding a therapist. Also, though, a lot of people can get referrals from other practitioners, like their primary care physician, different doctors that they work with, or just other people in kind of the wellness world too. But I think there's a few different settings that you can go to see a therapist. And I think that sometimes there can be like different understandings of what those settings are. So many outpatient therapists, outpatient meaning you're seeing a clinician, a therapist for the typical 1 hour session each week or every other week. Um, is typically in more of a private practice setting or a group practice. Private practice is typically one, maybe a couple of clinicians, whereas a group practice is similar to what Room to Breathe is, where you have multiple clinicians that are working together. Me being a couples therapist, I share a lot of clients with other people too, which can be super helpful in taking more of a collaborative approach. So that can be a good avenue to take if you are, again, just kind of looking for someone to meet with on a weekly basis. Private practice also too, a lot of folks will use insurance benefits to cover the cost for those services as well. For folks though that may not have insurance or don't want to use insurance, there's also though community mental health setting that can offer services either like at a sliding scale rate. Sometimes there are free services that are offered. It kind of just depends, but those can also be found, through internet searches, psychology today, things of that nature. Hopefully that answered that question. Am I missing anything? I'm trying to trying to think.
No, yeah, I don't think so. It's really helpful. Another avenue I was thinking for folks is to ask if there are comfortable people in their life who maybe
Mhm.
have talked about going to therapy, because a lot of times those referrals can be really helpful if it's someone
Definitely.
that your friend has really benefited from working with. And then for group practices too, what's helpful about that, maybe you don't want to see your friend's provider, but a lot of group practices have a certain model or ethos for practicing. Get room to breathe. We have a lot of practitioners with a somatic focus lens.
Mhm.
And so you could find a practitioner likely in that practice, or a therapist in that practice, who has a similar alignment
Yes.
to a therapist that your friend really benefits from working with.
Yes, definitely. Definitely. Because I think the word of mouth referral can be super helpful. And right, maybe you don't want to see the same person, or schedules don't align, things like that.
Mhm.
But it can be nice to at least start off knowing, okay, this is a good place to be, and then I can kind of find my fit that way. Because as you said, I mean, it's a daunting process. It's overwhelming. I mean, you want to make sure that you have the right or find the right fit. And it sometimes takes a little bit of time and energy to do that, but obviously is a worthwhile process to go through. So,
Yeah, absolutely. Yeah, thanks for answering that. Along those lines, when looking for a therapist, I know a lot of times you can find a lot of letters next to a
yes,
therapist's name.
yes,
And I'm wondering if you could tell us, what do those mean? How can you
yes.
figure out what the therapist's training or background is in, if you're noticing a lot of those confusing acronyms?
Right, right. Just basically an alphabet after their name.
Yes.
Yes. I mean, first and foremost, if you don't know, or if it looks like an I don't know, uncommon one, just ask. It is totally okay to ask. Right. There are many different credentials and all types of things. So, right, first and foremost, just ask if you don't know. But I will say the main ones that you're usually seeing are social work degree, counselor degree, doctoral level clinician, and then marriage and family therapist. So I will go through all those. So the social worker, fully licensed clinician, is going to be LCSW. Great. They have gone through a specific social work program. They are fully licensed, so they have met certain clinical hours and have taken an exam. Great. Kind of same thing for each of these different licensure types. So professional counselor, again, they have a background in counseling specifically, have sat through different I think two exams, don't quote me on that, but have passed certain markers so that they can practice too. A doctoral level clinician, so that's typically your psychologist. That is going to be a what a PsyD, so PSYD, or a PhD. They have, again, gone through a doctoral level program. If you need any type of testing done, those are the people that you want to go to, the psychologist. And then who am I miss? Oh, the MFTs. I know
Yourself.
myself. Um, that is going to be LMFT, like I said earlier. So the licensed marriage and family therapist. So that is going to be a clinician who specializes in working with couples and families, also individuals too. But that licensure type tends to have, obviously in the name, much more focused education and background on family systems, couple systems, things of that nature. Now, it doesn't mean that the other professions, other licensure types can't work with couples and families. It's just kind of a different background. So I'm trying to think. There's also, so those are kind of the main four, I guess you could say, of like, okay, if you are going to see a therapist, you want someone with those letters after their names,
Mhm.
or that like education. And then, right, some of the other subsets of those things, specializations, I think that's where it can get a little confusing, quite honestly, because again, there's just lots of letters. But like I said earlier, I mean, ask the clinician if you don't know. Also, quick Google search can help too. Particularly if you're looking for a specialization, say you want to, work with someone who has a background in substance abuse or addictions. That's again a very specific certification. That one is CADC. So you'd want someone who has that kind of certification. But again, those are the main four types of licensure types that you would want to find or want to have in a therapist.
Yeah, yeah, that's really helpful. And the way I think about it is that oftentimes there's a little bit of a different orientation to, or like training,
Mm-hmm.
foundation of the training. But when folks are working in private practice, all of those who are licensed are trained
Mm-hmm.
to provide individual therapy. There
Yes.
are some folks who will provide group therapy and couples therapy in
Mm-hmm.
addition to the MFTs. But that's something that an area of specialization, again, that they oftentimes get additional training and
Mm-hmm.
support in.
Mm-hmm. Mm-hmm. Right. But typically any therapist that's going to be, again, like in an outpatient setting, to your point, has a background in working with individuals, right, in kind of, like I said, I mean a therapeutic setting, but it's like, right, that's the bread and butter, if you will.
Yeah, yeah, absolutely. Thank you for that.
Mm-hmm.
I know we touched on this question briefly, but I'd love to expand on it a little bit more. Can you tell me how I can use insurance to go to therapy? What happens if a therapist is out of network, and how
Mm-hmm.
much does therapy typically cost in each of these cases?
Yes. So therapy can be, again, for most people who have health insurance, they do want to use those benefits to go see a therapist. And majority of the time, therapy is a covered service by insurance. Obviously, you want to make sure, talk to your insurance directly, talk to the billing department of whatever practice you end up going with, just to double check everything. But that is again, that's a way that people are using their health benefits to cover the cost. And a lot of times, if insurance panels, insurance companies will have a network, what's called a network of providers that accept the insurance plan. So that's kind of a first line of defense in like, okay, I want to make sure that this practice that I'm interested in going to, that and this provider that I want to see, this therapist I want to see, they are in network with my insurance so I can use them, so I can see them and use my insurance benefits to cover the costs, because the cost of therapy can range, but typically if you're paying directly out of pocket, it can range from like 150 to 200-ish dollars per session. It can vary a little bit based on um, the clinician that you want to see, the therapist that you want to see, if you are going for couples or family therapy. Group therapy is at a different cost too. But again, it's going to be specific to what insurance plan you have. So again, double check that. But that is a way that people go to have the cost partially covered. And again, contact your insurance to get more information on what the specific benefits are.
Yeah, yeah. The one thing I'll add too is that folks who have HMO plans can have a harder time
Mm-hmm.
finding providers. So most private practices or group practices take PPO insurances, and
Yes.
most practices will do a free insurance verification for
Mm-hmm.
you as well. So if you submit your documentation, if you submit
Hmm.
your insurance information, they should be able to run a verification check as well. And then that will include what your copay is, which would you say it's around like 20 to $30 on average for folks?
Yeah, I'd say maybe, yeah, maybe a little bit higher. Sometimes I think maybe like 40. It just, again, it just maybe depend 20, 40, somewhere around there, whatever like a typical copay would be. Um, that's again typically what it would be for an in-network therapist too. But to answer your question about the out-of-network therapist,
Mm.
and again, this is very plan specific. But just because a therapist is out of network does not necessarily mean that you can't see them. You certainly can. It just might be applied to then an out of network deductible, or you pay out of pocket up front and then you can submit verification of, that you saw that provider to the insurance company directly. It's a couple more steps, but my point is that there's still, again, if you find a therapist that you really click with, you really want to see, despite them being out of network, there's still ways to go about that too.
Well, yeah, thank you for that. I'm curious if your thoughts on how a client who's never been in therapy before
Hmm.
should approach a consultation. To be clear, a consultation is what typically happens after you reach out to a clinician and say,
Hmm.
"Hey, I'm interested in working with you." You'll typically get a free 10 to 15-minute phone consultation or Zoom consultation. So they get to know a little bit more about you. You can
Hmm.
ask any questions of them. What should I ask during a consultation?
Such
And
a
what should I be looking for if I've never done one before?
Yes, yes. I think it's such a good question because the fact of the matter is that shopping around for a therapist is a thing, and it's okay that it's a thing. It's, again, you want to make sure that you find someone that is a good fit and that you feel comfortable talking to. So I think a lot of times these consultation calls are important because you want to kind of feel out how, again, how what this person is like, how they communicate, but also if there are specific things that you want to talk about, hearing how they've worked with clients who are dealing with anxiety in the past, let's say, is helpful to know. What, how do they work with this? What are kind of perhaps some techniques that they use to help a person manage anxiety, cope with anxiety, if that's kind of part of the presenting issue. I think it varies in terms of how it varies from person to person of, if they want to know certain theoretical orientations and things like that. But certainly that's something to ask if that's important to you. If you want to know, okay, you come from a cognitive behavioral therapy lens, and that's what I want to help treat my anxiety. Okay, that would be something to ask about. I think trying to be good general rule of thumb, trying to be a little prepared for these consultation calls with a couple questions is helpful, just to make sure that you're doing your own due diligence and getting what you want out of it, because it
Yes.
is, your time. You want to make sure it's worthwhile.
Yeah, yeah. I think you brought up something that we talk about a lot, but
Hmm.
maybe isn't as um it doesn't make as much sense to other folks in
Hmm.
terms of theoretical orientations.
Yes.
Can you talk a little bit what you mean by that and maybe
Hmm.
how folks could do their research when they're thinking about what theoretical orientations might be helpful for them?
Yes, definitely. So theoretical orientation, it's kind of in it is when a therapist, like, kind of what frame of reference the therapist works from, I suppose is the best way to put it.
Yeah.
There are lots of different schools of thought in terms of, right, again, how to treat anxiety, depression, things like that. I think a lot of people will, right, do a little bit of like research on their own to see, okay, right, what are some ways to treat anxiety and things like that. So they might have a little bit of knowledge going into a call, but might not know exactly how a therapist would use different cognitive behavioral CBT tools. Um, but again, it's going to be different as we were talking about the different licensure types. Like there are just different approaches to things. So if you're wanting to know a little bit more of, again, I think the easier way to think about it is like, what is a therapist's frame of reference?
Mhm.
Like that's a similar way of getting more information about their theoretical approach. So that again might be a little bit more helpful to think about. Again, if you have a specific area that you want to focus on in your life or what you want to get out of therapy. But again, it's a lot of therapists they pull from a few different theoretical approaches, or they have a few different frames of references that they will use um,
Yeah.
working with people. But again, that's part of why the consult calls are important to see if you like what their approach, if it's going to work for you or not. Hopefully that
Yeah.
answers that question.
Yeah, yeah, it's kind of hard to ground it because it's something we talk about so much as
Right,
therapists.
right.
I tend to think about theoretical frameworks as, yeah, like you said, these specific ways of treating different conditions should be research grounded in research and
Mm-hmm.
evidence-based. And the research tends to show us what sort of treatment modalities or theoretical frameworks will be helpful for
Yes,
certain conditions.
yes.
There are certain frameworks that are helpful for people who have PTSD, post-traumatic stress
Mm-hmm.
disorder. And so you want to make sure that a therapist is grounded in one of those to help you with moving forward or pulls from a couple different modalities.
Mm-hmm.
I would say the main ones are, and folks can do their own research on this, CBT, which you named cognitive behavioral therapy, DBT, dialectical behavioral therapy,
Mm-hmm.
ACT, acceptance and commitment therapy,
Mm-hmm.
EMDR. I always mess up what the acronym stands for.
Eye movement, desensitization, and then repetition. EMDR. I think. Oh God, forgive us. I don't.
I know.
I think that's what it is.
I said it and I was like, I actually don't know this one. But it's about stimulating left brain, right brain
Yes.
connection for developing new neural pathways around trauma. And then there's IFS, internal family system. So
Mm-hmm.
you could do your own research on these different frameworks and see which one you tend to gravitate towards or seems really interesting to you. Because some of it is just working with what is interesting to you. They're
Right.
all just
Right.
different lenses
Yeah.
into understanding humans and human psychology.
Absolutely. Right.
Yeah, yeah. So I have some clients who say like, "Hey, I want to work specifically with this sort of therapist who
Mm-hmm.
specializes
Mm-hmm.
in this because I really gravitate towards it." Another
Mm-hmm.
one is somatics or folks who have specific SE or somatic experiencing training.
Right. Right.
And so you could get someone who specializes in that in addition to the letters after their name standing for the
Yes.
license that they
Right.
have.
Right.
So there's a lot of different ways we can get into the weeds here, but hopefully that's some helpful background
Yes.
information
Yes. And
that
again, like
helps.
tips to ask during a
Yes.
consultation call too. I mean, I think the ask as many questions as you can, and I mean, it's true in that there's, no silly question because right, you don't know and you're trying to figure it out and explore. So, right, ask away.
Yeah. And I always say working with a therapist is being in a relationship with another person. So also, do you like being in
Yeah.
space with them? Do you like
Yes.
the way that they explain things? Does it make
Mm-hmm.
sense to you?
Mm-hmm.
Do they listen in a way that feels affirming to you? Are they
Yes.
interactive in a way that feels good? Do you want someone who's more active in a session or someone who's a little more passive. So it's also about like, do you like their whole orientation to being a therapist? Do you like how they are in the session?
Right. I also think too, just because, so say you have a good consultation call with them, you meet a couple times and then you figure out like, oh, I don't think this person is right for me. That is okay too. That is information that, I mean, there's still other again, right, therapists, orientation, like there's other people that you can still, talk to and move forward with. Just maybe it's not that one person, and that's okay. That is okay.
Yeah, awesome. After someone goes through the consultation, say, I meet with you, we have a phone call, I really want to move forward to working with you.
Mm-hmm.
What happens next, and what sort of information do I have to give in order to start therapy?
Yeah, that's a good question because there is some paperwork, like typically intake forms that are required. Just as and both from a okay, what's your background, but also to demographic information and as we said, like insurance information and things like that. So yeah, I mean, there forms that, right, you will need to complete prior to starting. But I think the biggest one is that intake form, where you are going into some additional detail about your background and why you want to go to therapy, why you want to start. But it's a form in which you can fill out, to your comfort level too. Obviously it is different talking to someone face to face versus just, typing some or, putting something into a form. But usually that, I mean, it does help the therapist kind of get a good understanding of where you're coming from, what you would like to work on, certain goals that you may have for sessions too. Also, okay, if you don't know what goals you have too, that's something that you can figure out with your therapist as well. So this first, I like to think of those first few sessions as part of the intake process and getting to know one another, so that you get a feel of who they are, and then again can kind of figure out what some of those treatment goals are moving forward.
Beautiful. Yeah. Do I have to take medication when I'm in therapy?
No, you don't. Some do, but also some don't. Also, therapists and psychologists cannot prescribe medication. So I think just by nature of our work, we may have more anecdotal knowledge about medication, but we are not doctors. We don't have a background from the medication and the medical standpoint. So if a person wants to explore medication, they will need to see um, a psychiatrist or an advanced nurse practitioner, which more letters after the name, unfortunately, but either an MD or someone with I think it's APRN, but someone who is qualified to prescribe medication. But lots of people take the medication, but also lots of people don't take medication. Just kind of depends on what works for each human.
Yeah. Awesome. The last question I have for you, I think, is a good way to wrap this up.
Mhm.
Wondering if you could talk a little bit about like what progress in therapy looks like. Like what should I expect
Yes.
when I go into therapy?
Yes. Yes. Well, and I'm going to give a little bit of a very therapist answer, and progress can look different for every person. um, but again, I think that's where the treatment goals that you kind of set with your therapist can be super helpful and be a good gauge of, okay, am I working towards these things? Am I seeing am I seeing some change towards those? Or I think this sometimes happens that I'm realizing what brought me to therapy, like got my foot in the door, but oh, there are some other things that I also want to work on too. So it's not meant to be a moving goalpost per se, but um, progress again is going to look different for every person. But if you are feeling that or seeing changes in your, how you're thinking about things, certainly how you're feeling about, I don't know, certain situations, relationships, I don't know, interactions at work, things like that. I think that is a good gauge of like, okay, something's shifting internally. Um, Also though, if you aren't experiencing those things too, it's not to say that therapy isn't working. Maybe you need to talk to your therapist directly about it. And that's certainly okay to bring up too. If like I don't know if I'm making the progress that I want to be making, because that at least gives the therapist an opportunity and you an opportunity to reset and maybe change things up and figure out where you need to go.
Excellent. Well, Katie, thank you so much. If folks have any additional questions for you, how can they reach you?
Email would probably be the best. So it's Katie at roomtobreathechicago.com. And yeah, happy to help in any way that I can, even if it's finding a therapist or any of if people want more information about some of these questions too, happy to answer in a more thorough way.
Beautiful. And y'all can reach me at Samantha at roomtobreathechicago.com. Thanks, everyone. Thank you again, Katie. Have a great day.
Thank you. You too.